Welcome to Community Connections, brought to you by SCAN, the Social Community Activities Network, New Jersey's premier provider of continuing education for adults since 1988.
Hello, my name is Pat Bohse and welcome to Community Connections. Our first guest for today is Lisa Bonse, Director of Adult Protective Services for Family and Children's Services in Monmouth and Middlesex counties. She will be discussing adult abuse and how her organization help at-risk adults to continue to live safely in their homes and independently. So welcome.
Thank you.
So it's really nice to have you.
Thank you. I'm happy to be here.
So tell us a little bit about yourself and then also about Adult Protective Services.
Okay. As you said, I work for Adult Protective Services. I'm the director, and in Family and Children's Services covers both Monmouth and Middlesex counties. I've been with Family and Children's for 7 years this month, as a matter of fact.
Happy anniversary.
Thank you very much. And I really enjoy it. I have I'm a licensed social worker, and I have a master's in social work.
So for the audience, Adult Protective Services, they might have heard stuff about it on and off, but really what's a good definition?
Okay. One thing we're not, that a lot of people think that we're adult DIFUS, which is now actually DCP&P.
No, I'm going to say, what does that mean in English for the audience?
All right. DIFUS is the organization that deals with abuse of children, and they've just changed their name to the Department of Children Permanency and Protection Services. What we do is we investigate allegations of abuse, neglect, and exploitation of vulnerable adults who are living in the community. So the basic criteria would be they have to be an adult, so anybody 18 or older. They have to be living in the community, so we don't go into licensed facilities, hospitals, nursing homes, rehabs. And there has to be an allegation of abuse, neglect, or exploitation. And there has to be something that makes the person vulnerable. So it could be a physical disability, a cognitive impairment, a mental health issue, something that makes it difficult for them to advocate for themselves.
And so is this a growing problem?
It is. Just with the baby boomers that, as you probably have heard, 10,000, just in the United States, 10,000 people every day turn 65, and that'll continue for about the next 20 years or so. So the numbers are increasing, as well as the fact that we're all living, longer. So definitely the population and the number of people that could be affected is definitely increasing.
So in this particular population that we're looking at or talking about as far as boomers and older adults, what are some of the kinds of abuses that you're seeing?
Okay. So abuse could be physical abuse, it could be psychological abuse, it could be sexual abuse. That's usually what we put under the abuse category, and then exploitation and neglect are somewhat separate. So for the abuse, physical abuse could be obviously bruising, hitting, punching someone, pushing them. So there's actual contact. Psychological abuse could be threatening someone, threatening to put them in a facility if they don't do something, like give them money, for example. And sexual abuse, is more obvious. Neglect could be self-neglect, where the individual themselves is maybe no longer able to care for themselves as well as they used to.
And they don't recognize that usually.
Exactly. Either they don't recognize it or they're in denial about it. Sometimes it's a lifetime issue.
Yeah.
Sometimes they've always lived like this. But now that they're maybe 70, 80, 90, suddenly people don't want them to continue living this way and want it to change. And then exploitation, we're talking usually about financial exploitation, where someone is misappropriating their funds.
And I think that we're hearing a lot more about that particular abuse across the country in a variety of different formats. Can you just maybe talk about a few of those as far as financial abuse?
Absolutely. When I started 7 years ago, we would maybe get 3 calls a month about financial exploitation. Now we can get 8 referrals a day sometimes.
Wow.
So it's really expanded or increased significantly. Unfortunately, typically with all of our cases, most often the perpetrator, if you will, or the alleged perpetrator is a family member or someone close to the client, a caregiver in some way, shape, or form. Typically with financial exploitation, we're seeing that where the person was able to live comfortably, even on maybe a limited income, now all of a sudden they don't have money to pay all their bills. They might not have medications. If they use things like adult diapers, they are going without. And those could be some of the signs that are indicating that somebody may be financially exploiting them.
And so who makes some of those kind of referrals to you or makes you aware of those situations?
Well, anybody can make a referral. Literally, we've had someone from the gas company call and make a referral who was working outside an older woman's home for several days in a row. So anybody can call and make a referral to Adult Protective Services. You also have the right as the referral source to be anonymous if you would like.
That's really good to know.
Yeah, we will ask for your name and a callback number. If you want, you can make up a name if you want, but just in case there's like follow-up questions that we need to get back to you.
Sure.
But even if you give us your real name, if you say you want to be anonymous, we will not share that with the person. Because we don't want to, the people generally are calling because they're just concerned and they want to know if there's any services to help the person. So they're calling from a good place usually. But the client may not see it that way, and we don't want to cause any friction between them and someone who's, in their inner circle.
Sure. And I'm sure you get referrals from like the police and fire if they're going into a situation and they see something and they make the referral.
Absolutely. A lot of professionals call, doctors, banks call a lot now with exploitation. Okay. The police do call. If another agency like visiting physicians also, visiting the VNA, Visiting Nurses Association, Meridian at Home, any of those organizations that go into people's homes also make referrals.
So once you get a referral, how long does it take from that point to doing a home visit or making a determination or next steps?
Okay. So Adult Protective Services is both federally and state mandated. So in every county across the country, there is an APS unit. In New Jersey, for abuse cases, we have to go out within 24 business hours, and for neglect and exploitation within 72 business hours. So it's a pretty quick turnaround. And then as long as we have a case open, we have to see the client at least once every 30 days.
So that's pretty intense, but pretty good in regards to protecting someone who might be abused, whether it's, again, emotionally, physically, or financially. So thank you for doing that service. I mean, I know that it's a really, we talk about it a lot in the field of aging. I mean, I've been around for a while, but until you experience it and until you see it and how fearful a lot of our seniors are in regards to telling anybody their story because they don't know what's going to happen. So it's really good that there's an agency that can absolutely step in and help them and keep them safe and hopefully in their home and comfortable. So we talked about who the typical victim might be. What are some of the risk factors that you're seeing in elder abuse?
I think a lot of times as we age, our circle becomes much smaller. So we're not getting out and about as much. So naturally, we're not seeing the same number of people. So people that become more homebound typically are at higher risk for being abused, neglected, or exploited. Obviously, any kind of illness or health issue that requires them to be dependent on someone else, obviously that also will increase their risk factor. And then a lot of times too, just how many people are, everybody's so spread out now, like a lot of times kids don't live nearby, so they might live across the country, they're not seeing mom or dad as frequently, maybe they talk to them on the phone, and so they're not aware of who's coming into their life and who might be taking advantage.
Who's in and out regularly.
Exactly.
Yeah. So the other is how, when someone is deemed to be vulnerable, you step in, you make the assessment that they are. What would be the follow-up steps, and how do you help them?
Okay. So our primary goal is to keep people in their home as safe and long as possible. We don't have the authority just to remove someone from their home, even if we thought it was a horrific situation. So really the goal is to either put services in ourselves, it could be a home health aide, or refer them to other agencies.
Okay.
So for example, Meals on Wheels. Maybe that's all that they need, something just so that they have a good solid meal because they're not really cooking as much. So they have one good meal at least a day, and then they can supplement that with, yogurt or a sandwich, something that's easy for them to make. Visiting physicians, if they're not getting out to the doctor so much anymore, so now they're not taking medications because they can't get there for the doctor to give refills. So hooking them up with visiting physicians or visiting podiatrists. So really, or home health aide to come out and maybe assist with some personal care. And there's different programs throughout the county that if people are eligible for, we would certainly try to hook them up with those.
So we call those our community partners.
Right.
And really, without them, we wouldn't be able to do what we do. Your organization's been around for a long period of time, I think 100+ years.
That's correct.
I think you're the first social service agency in Monmouth County, and still going strong and doing a lot of diversified kinds of programs,
That's
which
right.
is wonderful. Do you have a bill paying program in case someone's not able to pay their bills, or do you refer them to other people?
Especially with exploitation cases, that is definitely an avenue that we would look into. So the program that we most usually use is representative payee, which is a social security program.
Okay.
So an individual could become someone's payee. A lot of times if we're getting involved, we've determined the person's been exploited, so we're trying to get the money away from that individual. So we would contact their doctor. If the doctor agrees that the person has some kind of cognitive impairment or physical condition, maybe they can't see the bills or see to write out their checks and they have to rely on someone else to tell them what it says. Then we ask the doctor to fill out a very simple physician statement, and we fill out the application for Family and Children's to become the representative payee.
And what happens if someone refuses your help?
Well, depending on the situation. If they are a competent adult, they have the right to live the way they want to live, and we respect that, and we will honor that, and we will actually advocate that they have that right. So, like if a landlord calls us and is upset because someone is a hoarder, we don't go in and remove them. That's their choice.
Absolutely.
On the other hand, if somebody appears to be lacking in capacity, there are legal steps that we can take to the extreme, which we don't do frequently, but sometimes we have to petition the court for a guardianship.
Okay, so I'm excited because now we know about APS, Adult Protective Services. I love the alphabet soup, and that you provide this service. So if someone wants to get in touch with you, or they're suspecting that someone might be abused, how do they get in touch with you?
So in Monmouth County, they can call us directly, 732-531-9191, and our hours are 8:30 to 4:30, Monday through Friday, and they will get a live person. We do recommend that whoever has the most firsthand knowledge should be the person to call to make the referral. Okay. Because if you're calling, because somebody else asked you to call, you may not be able to answer a lot of the questions. And we encourage people, always call if you're in doubt, call and let's talk about it. You don't have to have the smoking gun, you don't have to have the proof that the person's being abused, neglected, or exploited, but if you have concerns, call us and we'll try to help you. If we can't help you, if we're not the right agency, we'll refer you to another agency that might be better able to handle it.
So Lisa, I want to tell you that our time is up, and thank you for all of the stuff that you do in Family and Children's Services. And again, we're happy that we're community partners and look forward to working together in the future. We're going to be taking a short break, and we'll be back in a moment.
Now's a great time to make your home more energy efficient, and the New Jersey Natural Gas Save Green Project is here to help. Take advantage of rebates and incentives up to $19,000 designed to make your whole house more comfortable, improve performance, and save you money. Upgrade your older, inefficient heating equipment, central air conditioning system, and water heater with money-saving, high-efficiency equipment. But don't stop there. Your new equipment will have to work harder, wasting energy dollars if your home is not properly weatherized by reducing air and duct leaks and installing proper insulation. Call the Save Green Project at 877-455-NJNG or visit SaveGreenProject.com, and we'll help you get on the road to energy efficiency and savings, and explain how you may qualify for up to $19,000 in rebates and incentives. Call Save Green at 877-455-NJNG.
Hello again. My name is Pat Bohse, and now with us on Community Connection is Barbara Scholz, the Director of Advocacy and Programs for the FoodBank of Monmouth and Ocean Counties, who will be talking to us about financial services that the FoodBank provides. Welcome.
Thank you. Thank you.
So it's really nice to have you here, and I'm going to just maybe start because I have to tell you, when I first started working with the FoodBank, seems like forever, but it's 3 wonderful years, and I had met with your executive director, and he gave me the definition of the FoodBank.
Yes.
Do you know what he told me?
Exactly. Go ahead. Yes.
So he told me that the food bank has 2 purposes. One is food, and we understand that perfectly. But the other is bank, and that means to provide economic stability to the people that you serve, and you do that through some of these wonderful programs that you provide that people don't realize that you do. So let's talk about that.
Okay, sure. I guess I can talk a little bit about why we do both food
Absolutely.
and banking. It's not really banking in the terms of providing money to individuals, but we do help people to apply for benefits that they could be eligible for. See, what we do is we provide food, about 11 million meals last year, to over 130,000 people in Monmouth and Ocean counties. And in the last 5 or 6 years, this number has grown by 2. It's doubled. So it used to be a lot less. And you know, we think 5 or 6 years down the road, we can't let it double again. So we have to look at the root causes of why people are needing emergency food. And that brought us to the banking piece. So we realized that people just need additional income. Most of the people that we see at food pantries and soup kitchens, they either are working, have somebody in their household that's working, or they're not able to work anymore because they're elderly, retired, disabled. So the best way to do that is to try to make sure that these people also can access benefits that they're eligible for, maybe don't know about, and that would help to increase their income.
And so, again, we've been happy to work with you, and you've been doing some of your programs here at SCAN for the last few years, and I'm sure that you'll share with us some of the good news going forward. But talk to us about what is the 3 major services that you provide.
The 3 major services are assistance with food stamps, also called SNAP, the Supplemental Nutrition Assistance Program, and also health insurance, believe it or not, is a very big thing right now, and also free tax preparation. I'll start with the first, with food stamps. That's probably what most people would think, oh yes, a food bank, of course, would help with food stamps. If you go to a pantry, you'll get food maybe for 3 or 4 days. If we can help you sign up for food stamps, well, for a family, the average benefit could be as high as $250. For single individuals, it might be a little bit less, but it's still pretty substantial. And you can go to a grocery store just like all the rest of us, and what you get is a little debit card. It looks just like a debit card.
Yes.
You swipe that, so there's no stigma attached as well, and you can purchase what you need. So we really try to get as many people as possible signed up for that, and it's a benefit that you get every month.
So let's stay on that for a minute, because we have had the opportunity with our new Scan on Wheels. We're now going into the community and providing services. Right now we are in one location, which is the YMCA of Weston Monmouth. Yep. And we had the opportunity to ask you and your team to come in and to screen potential seniors who we're working with for food stamps. And I know the 5 of them that went to be screened were eligible.
Yes.
And so that was, I mean, very exciting for me, I'm sure for them. And again, looking at people who are on limited incomes, and they're not, I mean, I love when we talk about getting ready to retire. These people have been retired for a long time and never looked at how within their dollars that they can save some money or are entitled to additional benefits.
Exactly.
So we're excited about that too.
Yeah, we do go out to many different sites in the community. One of them, of course, is yours. We go to maybe about 20 or 25 different sites each month. So, you know, if you can check out, a lot of them are pantries, but a lot of them are also nonprofit community organizations, including the Y, like for you.
And so if someone was interested and wanted to use this program, they could just call and find out where their nearest location would be.
Exactly. We have a hotline, which is 732-643-5888. And just follow the prompts, because we can assist you with food stamps, also health insurance, and free tax prep if you just call that number. And it's all free, confidential. If you are eligible, wonderful. If you're not, you know, that's fine too.
Yeah, and again, like food stamps, the old food stamps, I mean, it's amazing that that one can just go into a store and
Yeah.
use a debit card. And again, it's not being labeled and not feeling uncomfortable. And I'm just so excited about that, because that really stopped a lot of people from applying.
Yeah, yeah, and it is a year-round thing. You can apply really basically anytime. Some of the other programs, they have specific times where you can apply for that. But
So the next program we're going to talk about is
health insurance.
Okay.
As you may know, the open enrollment period is from November until January. That's just for the online marketplace, also known as Obamacare, as some people call it. So that is November through January, but then there are also other options like Medicaid or NJ Family Care, which you can apply for year-round. So what we would like to do, especially during open enrollment, is just, again, go out to the different communities and just talk to people and let them know that there are significant financial subsidies available. So it really is affordable.
And so when they come, they're screened for all of those programs.
They're screened for all of those programs.
So explain that, because I think people think that they have to go through it over and over and over again.
Oh, no, no, no. So for example, if you come in for health insurance because you know you don't have it at this point, we'll assist you with that first of all, but we'll also check to see if you're eligible for food stamps, if you're eligible for utilities assistance or any other programs, as well as free tax preparation. If you like, we can also let you know during tax season where we're going to be, and we can help you do those as well.
Yeah, no, I'm excited about that again, because we're working with people in the community now, and also our members here at SCAN, providing them with this information, because even though we make assumptions that people are okay and comfortable, in reality, they're not.
They're not, no. And even with health insurance, if you think about now, if you have a broken arm, it might cost you maybe up to $3,000. If you need surgery in a hospital, if it's a complex fracture,
cheap.
$20,000 and up. So, you know, it's a little bit like car insurance. You don't plan for that accident, but when it hits you, it really hits you hard. So it's good to pay a little bit of a premium each month, subsidized, of course, by the federal government. And there are significant subsidies. So.
And what's the enrollment period again?
It's from November until January. I know some people, we also, because we do taxes, we saw some people that hadn't signed up were paying a penalty the first year. So this coming year, if you don't have it in 2016, it is going to be a whole lot more. So it might be something to kind of look into if at all possible. And just give us a call at that number and we can help you.
What's the number?
732-643-5888.
Okay. Now, again, because we're past the open enrollment period right now, do they have other options to get in on it?
They can do this year-round. It may also be a special enrollment if they've just lost their job, for example, or if there's been an addition to the family, or if they lost a family member. There could be that they're eligible for a special enrollment.
Okay, so they should not just because of the dates, not
Exactly.
call.
They should call. And they could be eligible for something like Medicaid as well.
Okay.
So that's year-round. So.
And so the third program, taxes.
Yes.
My favorite subject.
And that's something that most food banks, you wouldn't think, why is a food bank doing tax preparation? Well, you know, we know that this is a significant poverty alleviation measure. There's something called an earned income tax credit. Which
that's always, I don't know what that means.
It's a credit that you get on your income tax return that could be as high as $7,200 this year if you consider federal and state credits. But unfortunately, you have to file a tax return. So a lot of people think, oh, I don't owe anything. I'm going to save the cost of tax preparation, and I'm not going to file. And then they don't get the EITC, the Earned Income Tax Credit. So what we do is we go out and say, hey, we'll do it for you for free. And you know, we have volunteers that are certified and trained through a special IRS program. A lot of them are also retired accountants and CPAs, so they would be able to help as well. And we do this all for free. We're going to be this upcoming tax season. We're going to be at all the major malls. We're going to be at the Monmouth Mall, at the Freehold Mall, at the Ocean County Mall, and a lot of the libraries as well. So people can come in and just, you know, there are certain eligibilities. So if you're under $60,000, essentially, for a family, we can help you file your taxes for free. There's a certain scope of work as well, which, you know, you can go on our website or just give us a call at that number and we'll be able to explain everything to you.
What's the website?
The website is the FoodBank website, www.foodbankmoc.org. Okay, and the number 732-643-5888, and just follow the prompts.
So
okay?
I love repetition because people finally, after they heard it the first time, they're saying, so what was that number? And now they had it the third time. So I appreciate that. So the other thing I want to talk about is the food bank. We have some time to spend on that. I mean, I recently was there because I received my food handler certificate.
Okay.
And so maybe you can just share with us some of the other stuff that you guys are doing.
Well, what everybody knows us for is that we have a big warehouse. We collect donations throughout the year, and we distribute that to about 300 programs in Monmouth and Ocean counties, mainly food pantries and soup kitchens, but also other community organizations as well. And they give that out to families in need. So there is a variety of programs with that. Sometimes our truck just goes directly to a food pantry and will deliver food. We have something called a backpack program, which helps children in need at schools to get some food for the weekend. So every Friday afternoon before they get on the bus, they might get a package of food, very confidential, and that helps for the weekend as well when they might not have access to school lunch, for example. We have a senior program where we go out to some low-income housing sites for seniors, and we provide packages of food for seniors as well. So yeah, there's quite a bit going on. And of course we have a culinary job skills training program.
Talk about that.
Yes, we've been doing this since 2002. We've trained over 270 people. So basically anybody who is in need of permanent employment. A lot of the people start out, you know, basically either unemployed or maybe just earning minimum wage. And it's a 12 or 13 week program. And after the end, we help them to find a better paid job. Usually they start at about $11, $12 an hour. And then after a few months, they work their way up. So it
And you
really,
have a new kitchen.
Yes. Right now we're in Monmouth County, but we're also going to be in Ocean County in early 2016. I'm not going to say what month, but it's going to be in it's a moving target. It's going to be in 2016. We're going to be in the Silverton Plaza off Hooper Ave in Toms River. So yes, we're really looking forward to that. We're going to have client services there. We're going to have another culinary job skills training program, and we're going to be in partnership with the John Bon Jovi Soul Foundation. There's going to be a soul kitchen, a community restaurant there, which basically provides food at no charge for volunteers. So if you can't afford to pay for a restaurant, you can volunteer somewhere and you get a ticket and you can have a nice meal there as well.
Very similar to the one here in Monmouth County.
Exactly, exactly.
And that's a really wonderful partnership. And I know that, I mean, SCAN will be going into Ocean County too in 2016. And so we're really excited about that. I'm not sure if we're following you or you're following us, but oh well.
We're doing it together. We're going to jump.
Yeah, no, I'm really excited because we'll be doing a brain health fair in Ocean County in 2016. And we are doing classes in the Bohse Host department store in the Ocean County Mall.
Okay.
And they're going over famously. So we have 1 minute left, so any closing remarks?
Oh, just if you think that you might be able to benefit from any income supports, whether it's food stamps, whether it's health insurance, whether it's free tax preparation or anything else, please be sure to jot down the number 732-643-5888 and give us, our outreach team at the Food Bank, a call. We'll be happy to help you.
And I, again, thank you for coming. I love working with you guys, and you give me lots of challenges, and I appreciate that. So we're running out of time. I want to thank Lisa Bonse and Barbara Scholz. I'm sorry, and I am sure that the viewers found this information incredibly interesting and informative, and we will continue to bring you good information, trusted information, month after month, especially going forward with our new focus on making everyone's lives as full and fruitful as possible. Thank you.